over the minutes, and after they have perused them, I would accept the motion.
Motion to approve, Mr. Chairman.
Second, all in favor, let it be known by the voting sign aye.
Aye.
Opposes by the same sign. New business, RFP response from Maud Watley Health Services to acquire the former Benjamin Barnes YMCA and Weaver Bolden building, Maud Watley Health Services. Come on, and we would like, yes, sir.
Yes.
Mr. Tom Bobbitt.
A few little historical background on this. Late last year, we were authorized to issue an RFP regarding the old Benjamin Barnes YMCA and the Weaver Bolden building to discern if there were any interests regarding that building for either acquisition or lease. During the responses we received one response from Maud Watley Health Services, and they are here today to make a presentation to the Properties Committee regarding their response to that RFP.
Okay. Thank you so much. And this RP, as I remember it, we set it out almost a year ago, correct?
No, we sent it out, I believe it was in October.
October, right?
Yes, sir.
Okay. All right, Maud Watley, I see our CEO, Mr. David Gay, Reverend David E. Gay, Jr. Please come to the podium.
Thank you.
Glad to have you all today.
Thank you again. Thank you, Mr. Chairman, and all of you all who are here today. The fact that Maud Watley was the only person who answered the call for the RFP, that may be good, but it may be bad. It may be something we don't know. So, but again, we appreciate the opportunity. We appreciate going through the process, and I do have some staff with me over there. Charmaine Harris, Administrative Assistant David Morris, who's our COO, and it's Barbara. Barbara's our everything over there. She's our clinical nurse specialist and our clinical administrator. And so again, thank all my staff for being here with us this afternoon, and thank you all. I think we have a presentation.
Okay,
If you'd like to use that,
there's a
the
clicker
clicker right there, the silver,
at the podium.
right there.
Is it?
Yeah, this.
Oh, it is clicker.
There you go, and just hit that center button, point it
Okay.
at the TV.
But again, thank you. We are Maud Watley, and I think again this presentation is real short.
Okay,
So if you got something to do, you can go and crank your car up. It won't be long. I can assure you that I'm already rushing to a
close.
conclusion. Maud Watley, our mission, that's our mission statement right there. We're a nonprofit organization. I tell the staff all the time, we're a nonprofit, but we still have to make a profit. We still got payroll, we have bills we have to pay. So again, we may be under the nonprofit status, but we still have to make a profit. But we only have one mission. That mission is to provide good quality of care to those who walk in our doors. And I often tell the staff too, whether it's in the slide or not, and we have to do it with compassion. Anytime you're in healthcare and you don't have a compassionate heart for people, you're in the wrong business. And so we need to get out of that. So we do it, and we do it with compassionate care. It was an humble beginning by a woman by the name of Maud Watley, who was a local educator here. She was the principal down at 32nd Avenue School. What's interesting about it, you can stand on the steps of the old Benjamin Barnes YMCA and look right down the street where Maud Watley was the principal. And I think that's only befitting of her legacy. Lady that realized there was health disparities in West Tuscaloosa primarily, got together with some students and formed a little one house there right off of Herman Avenue, and now it's blossomed to what it is today. Several satellites in several counties throughout West Alabama. From my humble beginning, one lady, one mission to bring health care to those who was in need of health care in West Tuscaloosa, Maud Watley. Who we are not. We're not football players. Roll Tide, we got that team right here in Tuscaloosa. We're not race car drivers, we're not farmers, we're not astronauts. We're none of those people. But we are healthcare providers. That's what we do. We try to stay in our lane, we try to stay within our scope. And we don't want to be anything else but healthcare providers, and be the very best healthcare providers that we possibly can. Last year, we served over 17,000 patients. And when I say 17,000 patients, that was what we call uniques. These are one-time people. One time they come in our doors. Every year in January we start the count. So 17,000 brand new people walked inside the doors of Malt Watley. Overall, 61,000 people came through our doors. That's a lot of people. Malt Watley and its satellites. That's a lot of people. 17,000 what we call unique brand new people, but 60,000 plus folks overall that came through our doors. Again, so we serve a lot of people, whether it's here, and we'll talk some more about it in our satellites in a few minutes. 58% of those was African Americans, 21% was white, 19% Hispanic, and 2% others. And we're seeing more and more of the Hispanic population come to Malt Watley. And that number is rapidly increasing in our communities. In fact, we have so many at Watley that every station have someone that's bilingual. Every station at Malt Watley have someone that's bilingual because of the huge Hispanic population that's been walking in our doors. Key management staff, again, myself and David and our CFO, Ray Sherman. We have about 156 employees. That changes day by day. We, just like everybody else, find it hard to find good employees. It's hard to find people who want to come to work. We got people who ain't sure for the interviews. And again, most of you all who are in the hiring business know what I'm talking about. Won't even sure for the interviews. If they come to work, they don't want to work. So work ethic is something that's still a thing of the past.
Is that 156 employees just in Tuscaloosa, or is that regionally
That's throughout our satellites. But the bulk of them
or here?
are right here in Tuscaloosa. Probably 120, some of those are right here in Tuscaloosa. Very diverse workforce, and I mentioned someone that's bilingual in all of our teams, again, because of the huge Hispanic population that walk through our doors. We got some long-term employees like our CFO Ray Sherman, been there for 20-something years, and got several people been there 20-something years who enjoy the work that they do. Those are the different sites that we have right now. We have sites in Ellisville, sites in Carrollton, Utah. The main center here, and I call the center here in Tuscaloosa the flagship. I gave it that name. I called it one that's on Martin Luther King Boulevard, the flagship. In the rural areas, we call our satellite clinics, it's mainly primary care. But at the flagship on Martin Luther King Boulevard, anything you think you want, whether podiatry, whether it's peds, whether it's behavior health, we got our pharmacy there. It's a one-stop shop. So you walk in those doors there, you can get just about anything that you want right here on Martin Luther King Boulevard. Again, we call that the flagship. Pickens County, we up in Sipsey, Sumter County, and Vernon. So we got sites throughout what we call throughout West Alabama. We was featured during COVID. CBS nationally featured Malt Watley of his work in rural America. We have a big mobile unit that's equipped that we can go out in rural areas and see patients and treat patients and do what we need to do. And again, they did a story on Malt Watley and the work we did in rural Alabama. Again, it's counties that we serve right there. Again, Bill, Fayette, Green Hill, Lamar, Pickens, Sumter, Tuscaloosa, and Walker counties. Again, some of the services that we provide. Again, a whole list of them: family medicine, preventive medicine, prenatal care. You can read on and on and on and on and on. You just about name it, Watley can provide it. We can provide it for you, and we real proud of that. That's a long way from the mission and the vision that Malt Watley had when she started this clinic back in the mid 70s. Our plan, if we are afforded the opportunity to acquire the property, our plan, There are a lot of things we want to do, we're landlocked where we're at right now, that we cannot do. The old Benjamin Bond YMCA holds a special place in my heart, personally. I grew up in West Tuscaloosa. I went to school at Druid High School. I'm a dragon all the way. I grew up on Jefferson Avenue, not far from that. On Friday nights is where we went and did our sock hops. That's what we danced at. So I'm a product of it. We played Little League baseball in the field right there. So I'm a product of West Tuscaloosa. I'm a product of the Benjamin Barnes YMCA. Benjamin Field's son graduated with my wife from Druid High School. So I know the family personally. So the YMCA holds some significance to me personally because of my growing up in that part of Tuscaloosa. A lot of things we can do with the building, it's gonna take a lot. It's not gonna be easy, whoever gets it, unless somebody put a bulldozer to it, but to come in and to remodel that place, it's gonna take a lot. Because the building's been there for a very, very long time. And there's really nothing in it right now, no way we can use it like it is. So it's gonna take a lot of gutting and a lot of renovations, a lot of things. But even given that, there's some things we think we can do. There's some services we don't have. And I can't see the screen clearly, but there's a lot of services we don't have. Number one, we wanna make sure that the community is part of what we do. YMCA has always been part of this community. And we want to continue to make sure we have that same legacy. But there are some services we don't have currently that we would like to bring over there. We got podiatry services right now in Mount Wally, but we need to expand that. We got one of the best foot doctors, and we got people come from all around. Councilman Wilson, Cardin Hogue, all the way from Maryland, Alabama. We got people come up. We got one of the best foot doctors in town to come there. But we need to expand those. We need to expand those services. Some behavioral health services, some mental health. We all know the need for mental health in our area.
Yes.
But that's something that's lacking too. We're trying to get us a psychiatrist, and we're trying to enhance mental health, and that's something we definitely want to do. A wellness center. We're not doing it in we're not doing it in the wellness stuff. We don't have the space to do it. Wellness with the field out there. We want to do some preventive thing. We got some diabetic classes we do for those people who have diabetes, but we conduct a lot of those at McDonough Hughes Center. If we had our place big enough, we can do our own, get that big gym there, but we also can use that field out there for exercise, or we're planning on putting a walking track out there as part of prevention. People can walk around and enjoy themselves as part of our wellness. X-ray, we don't have an X-ray. So many of our patients, we have to refer out for X-ray services. But if we have another building, we can put X-ray down. Again, these are services we currently do not have. And again, with us being in the vicinity that we have transportation. So we need a patient to come to Mount Wally proper and need to be transferred to get an X-ray. We can provide that transportation for them free of charge, but we don't have X-ray. Chiropractic service, another one we want to have. Optometry, that's something I always wanted to have. We don't have anyone now who can work with our patients with the eyes. And we want to also have a little shop, a framing shop. Not only can you get the eyes examined, but I also put a little shop in where people can go and purchase their frames and different things like that. Again, these are services we do not have. We don't have them at all. But with that additional space there at the YMCA, if we can go in there and do what we want to do, those are some services we can have. Denture services, we got a fine dental department, but we don't do dentures. And we want to one day be a one-stop shop. You can come there, you can get your teeth examined, your teeth cleaned, but if they need to be fitted for dentures, we also want to do the same thing. So we want to be able to do that too. Overall, our goal is to continue the legacy of Mount Wally. And again, primarily we'll use that building to do some things we currently not doing. One additional thing that's not on the slide, the library that's next door to it, We would like to use that for a multi-purpose room, for a community room, where people who want to come in the community, want to have some meetings. It's, again, free of charge. They could use that. We'll turn it into a multi-purpose building, multi-purpose room, where we can have community meetings. We can do some educational things in there. A whole lot of things. It's a big, nice room, but again, more of a community room that the community can use free of charge. But we want to continue the legacy of Mount Wiley. It's nothing fancy. It's all about healthcare. And again, we hope that we be given an opportunity. If it's something we can afford, we are definitely interested in it. Again, continue the legacy of Mount Wiley, providing good healthcare here for people of Tuscaloosa. And that's our presentation. And again, I'll be happy to answer any questions that anyone have at this particular time.
Questions from the committee?
If there was an agreement for you guys to purchase this, how long would it take you? I mean, would it be in stages? I mean, talk a little bit about the time it would take before you'd be ready to start seeing people and open services that you think is reasonable.
Probably a month ago, I could have been more, I probably could have told you more directly. So, let's be honest with you. We are, most of our funds are federal funds. And so, again, just saying, I couldn't give a definite answer, but we would do it in phases. We would do it when we think it's the appropriate time to do it. And again,
But in the best case scenario, would you say a year?
Yeah,
Probably a year from now?
Absolutely.
You'd open?
absolutely. Not saying this, it will be open, but
But
we
you'd
sure
be-
hope to be starting,
You'd be working on it.
be working on being open,
Yeah.
something like that, yeah. And again, it's just so hard nowadays to say, because it all depends so much on the funding, so yeah. And just being honest with you, period, I mean, I would call it like it is, and we hope to,
Can I ask a question, Mr. Bobbitt? Mr. Bobbitt?
Yes, sir.
Explain to the committee, Mr. Chairman, what is the process that we go through to talk with them about this?
Well, the process we're having to go through is because federal CDBG money was used for this building. So we have to use federal procurement and federal disposition procedures. So we've done the RFP. Being that federal money's involved, there is a requirement that if it's sold, it'd be sold at fair market value. If it's rented, it has to be rented at market rate, fair market rate. So basically what we would need to know today is, from what I understand, that Pastor Gay's saying that they would like to acquire it outright.
Yeah.
So the next step would be to determine that value. Would ask the council to allow us to get an appraisal on the property.
So we need a motion to do that?
Yes, sir.
Okay.
Motion.
Second, all in favor, let it be known by the voting sign aye. Aye.
Okay.
Well, Pastor Gay, thank you so much for coming, and I want you to know we appreciate your love and your care for our community. Just a futuristic question that I've asked you about earlier, a while back, that some of those names of those rooms, as you all prepare, that when people walk in those rooms, whether it's the Maud Watley room, whether it is the all roads, all avenues, Brother L.V. Hall.
I think it's appropriate.
Do you think that would be something appropriate?
I think it is. My first thought when we talked about Benjamin Bond years ago was maybe that would be a good museum over there. I never want to see the building torn down because of its historical significance. People like L.V. Hall, who crusade so many years and raised funds for that, Coach Cunningham, and different people who in our neighborhood, Mr. Freeman, different people.
Right.
And so it's always appropriate to go back and look at people like that. And sure, that's always possible, naming rooms, conference rooms, for people who really have made an impact in our area, for our kids that grew up, all of us in terms of West Tuscaloosa. Yeah.
I thank you so much for that, and I look forward to getting it. Mr. Bobbitt, what's the timeline on us getting back with this?
We will order the appraisal, and if it is hopefully we can turn it around and come back to you next month for the next properties committee. That'll be our goal.
Okay. All right. Thank you so much. Thank you,
Thank you.
Pastor Gay and
Thank you.
Maud Wilder for your presentation.
Thank y'all again for listening to us, and again, thank you, we really appreciate it.
Yes, sir. Agenda item number 2, follow-up discussions regarding the old fire station. Mr. Bobbitt?
Yes, sir. As you recall, last month, we brought this matter to you for disposition of Fire Station
Thank
11, if y'all were interested in
Thank y'all.
either sending it out for an RFP or that we had one individual that was interested in it, and y'all authorized us to have an appraisal performed. And that's what we're doing today, is informing you the value of that appraisal was $365,000. And the next step is whether you would like us to negotiate with that one individual or whether you would like to put it out for an RFP for disposal.
Committee?
Tom, in the normal course of business, don't we usually do an RFP to see that, or in this particular case, what's your opinion of that?
Where this fire station is located is on the Covered Bridge Road. There's not a lot on that road. There's one other building up there that I'm aware of. I don't know, sending it out to an RFP, how much interest you're going to garner. Now, does that mean that you may get interest from either the municipalities that are out there for a fire station? I don't
Could.
know. It's a possibility, but I think one thing we have to remember about this station is it has a specific use, was built and designed for a specific purpose, and there aren't generally a lot of other purposes you can use for it. So that narrows the field down of anybody that would be interested in this. So it's fire stations are difficult to dispose of because
Because they're fire stations.
they're fire stations. Exactly right.
And so will
Could have
we,
said it better myself.
if we proceeded on with the one person today, what would that process look like?
We would negotiate with them, ask them if they are interested in in purchasing it for that amount, and
Come back to us.
come back to you. And if they're not interested, then we might have to go the RFP route.
I think it's
Entertain a motion.
motion.
Second, all in favor? Aye.
Aye.
Opposes by the same sign. All right. Thank you. Mr. Bobbitt, discussion regarding the disposition of the Alberta Parkway project remnant parcels.
Yes, sir. You got the map.
It's in their packet.
It's in their packet. You can look at the packet. I don't have a copy with me, but if you look
Mhm.
at the packet. There it is.
Mm-hmm.
And this goes back to when I'll try to speak as loud as I can. We purchased the Alberta Parkway many years ago.
Mm-hmm.
We purchased all these lots that you see that right here that are south of Alberta Parkway
Oh, wow.
for the project. What you see here, these lots right here, that was what was used for the right of way.
This.
What you see in highlight are the remnants, was left over. We had no need.
You're talking about this right here, right, Tom?
Yes, sir.
The darker portion?
Darker
Yeah.
portions of the remnants were not needed. The property owner to the south asked that we consider conveying those lots to them because they have property down there that they would like to develop. And basically, if you look at who's interested in those properties, there's only one person that can be interested. So we've gone through the federal process of having those properties, if we use federal funds, those properties reallocated for a different purpose.
So we'd
we
have to do an
authorize-
RP?
No, we could if you wanted to.
Okay.
But the process we've had to go through is because there was a specific purpose for which these lots were acquired. You have to go through the process of a public hearing and comment period to use them for something else. That's been done through Mr. Howell's office, and we've had an appraisal performed. So it is up to you. There is somebody that is ready, willing, and able to buy them, or we could continue, again, put them out for RFP. But as you can see, we're not going to sell anybody
Right.
anything north of there, and I doubt that individual who is south of there is going to sell anything. So basically, there's only one party that's really.
Right.
There's only one party that makes sense to buy them.
To buy.
Yes, sir.
Okay. Questions from the committee?
So what we would do is request that you allow us to dispose of them, we would put a resolution, or I mean, an ordinance on next week, declaring them surplus and ordering the sale.
I'm fine with that.
Make a motion for that.
Second, all in favor?
Thank you.
All right. Thank you so much. The last agenda item for today is an update regarding the Pastor Linton's barbershop property. And I'm grateful today to have Mr. Tim to give us an update. As you all know, Pastor Linton was a great icon within our community, and he was a great civil rights leader. He believed in bringing people together as one. And we are definitely working on the Linton's barbershop property. And I want to thank Tim and the staff and all of you for being here today to give us some updates so that the community will know that we are diligently working to bring this project to reality.
Yes, sir. And unfortunately, we're not to the point where I've got any renderings to show, but
Okay.
but I am prepared to talk about where we are in
Yes,
the
sir.
process, and so we are tracking on schedule, and currently our schedule is to put this project out for bid in May, have the bid opening early or mid-June, and hopefully we're under funds available and we award at that time. We've just received, as of yesterday, the 60% design package from CCR Architecture.
Okay.
At the end of the year, we executed a contract with Caleb O'Connor for design and creation of the mural that'll go on the back wall. It's a partially relief panel as well as painted panel. We've met with the Linton family very beginning of January and reviewed Caleb's proposal. They were very excited with what they were seeing, and they have asked to be included when we are able to review the 3D model that Caleb's going to provide. And so, like I said, we received the 60% design package yesterday. We have a two-week review period, and we've got our next design package will be in March with our final construction documents in April, and we'll go to bid from that point.
That sounds good. Any questions for Tim from the committee?
Tim, once that is bid and the bid's accepted, how long would you expect this construction to take for it to be open?
So it's a relatively simple design, and we have gone ahead and demolished the previous structure on the property. And when I say simple, I mean we're not going vertical. It's not a building. It's a park. And so I would expect that, assuming we're under funds available and can award that bid in June, that we would be completed with this park before the end of the year, end of the calendar year.
Okay. All right. Anything else? Tim, thank you so
Yes,
much.
sir.
Thank you all. The next Properties Committee meeting will be April 1st, 2025. Are there any comments or any additions to our agenda from committee members?
Motion to adjourn.